The mission of Connecting Kids with Care is overall just to provide health care for at-risk and vulnerable children all over the world. We center around kids who are living in orphanages, in children's homes, in foster homes, all over the globe. We are able to treat a wide variety of patients because we use telehealth. So the providers that we utilize get really excited to be able to partner with us because there's a lot of clinicians out there who can't take 2 weeks and go on a medical mission trip. We're able to utilize everyday physicians here in the U.S. that want to be able to make an impact and make a difference.
Connecting Kids with Care sent me an urgent message in the middle of my working day asking me to review a file. It was not much information. It was a picture and I think 2 sentences of his history.
That file included information about 2-year-old Ronald, who was diagnosed with hydrocephalus, which is a buildup of spinal fluid inside open spaces in the brain.
And I was able to send a message back urgently saying exactly what Ronald needed.
Dr. Desiree White, who lives in Seattle, recommended surgery for Ronald and a shunt to drain the fluid. Connecting Kids with Care worked alongside partner organization GraceWorks Initiative to get Ronald the surgery he needed.
The organizations that we partner with are all focused around providing care for kids all over the world.
Connecting Kids with Care is its own nonprofit funded by Jackson Healthcare.
Within our Love Lives program, we have 2 primary focuses. One is providing people access to healthcare that don't have it, and the second is supporting children who are in need. Connecting Kids with Care nails both of those.
Ronald is one of more than 2,000 children Connecting Kids with Care has touched since the organization started 5 years ago. More than 100 medical professionals volunteer their time touching other parts of the world through telemedicine.
What's really neat is to see how Jackson Healthcare, and especially locumtenens.com, our largest company, has really embraced it. Because of our business, we have access and relationships with literally thousands and thousands of physicians. And these are people who began practicing medicine because they wanted to take care of people. They wanted to provide care.
Anytime that we can come alongside families, patients, and provide care that is needed to meet a need and do it willingly and offering of our time, I think that is a beautiful, beautiful thing.
There's a lot of barriers for a doctor to go internationally and work and do medical missions. It takes a lot of time. It takes a lot of money. One of the beautiful things about Connecting Kids with Care is that it enables physicians that really otherwise probably wouldn't make sense to go do international missions, and they don't have to take all sorts of time. If you got 30 minutes on a Thursday night, dial in and spend a few minutes taking care of a kid. The doctors want to do it, and then once they do it, they just get addicted to it because they love taking care of these kids.
Now that Ronald's life has been saved, hope has been restored in their entire family.